Let's get back to our virtual town hall now, and we have this question that we got on our voicemail last week.
Yeah, this viewer wanted to know how the virus is impacting a region that's very close to us, but that we haven't talked about a lot lately.
Why is it that we haven't heard anything about COVID-19 coming from the Canadian side of the border, from like Niagara Falls, Ontario, St. Catharines, Hamilton, and Toronto? They're much closer to us than a lot of other places that are being reported on.
Yeah, she brings up a very good point. Since the border got shut down for non-essential travel, we really haven't talked very much about what's happening with our friends to the north. We have quite a few viewers there, and also there are Western New Yorkers who own property in Canada who wonder when they'll be able to get over there and enjoy it.
Yeah, and while we wait for that answer on when they'll be able to travel over, here's what we can tell you about COVID-19 in Ontario. There have been about 20,000 confirmed cases in the province, which has about 15 million people. Of course, it's huge. So the rate there is much lower than here in New York State. We've had many more confirmed cases. And think about this, we've actually had more deaths in New York State than Ontario has had cases. That's how much worse it is.
Yeah, amazing. Canada is beginning to slowly reopen. And today, Prime Minister Justin Trudeau said his country still needs to ramp up testing.
I think we need to do more testing right across the country. Last week, we hit our 1 millionth test for Canadians, but there's a lot more to do. We know that as the economy starts to reopen, it's going to be more important to ensure that we have strong testing protocols right across the country. We need to increase the numbers. We've managed to support the provinces on obtaining reagents, on obtaining equipment for it. We need to see more lab capacity opening up, which many provinces have already done in turning to universities and private labs. There's lots more to do on testing, and we need to make sure we're working on that all together.
Yeah, sounds like the same thing that we're dealing with here in the United States, but they are beginning to open things up in Canada as well, so something that we will continue to keep you updated about.
Yeah, our countries really have unique challenges, and certainly, you know, our proximity to Toronto may have played a role initially in infection rates, but, you know, it's going to take a little while, Michael, for all that data to come together for any real conclusions to be drawn.
Yeah, I think in Canada, they are surprised at the low number of cases compared to like here in the United States, especially a city like Toronto compared to New York City, much lower.
Absolutely.